It's Patrick Hutzel from intensivecare.hotline.com with another quick tip for families in intensive care. So today's tip is for Loretta, who has an email, and Loretta says, "Hi Patrick, my brother nodded yes when asked if he wanted some ice cream. Today again, he is in a medically induced coma for being septic, and they have been lowering the medications to try and bring him out of his coma slowly, and also are having a tracheostomy to be scheduled. Do you think that this is necessary to do a tracheostomy? Can you give me your professional opinion on what you think about the situation right now that I just told you about?" Well, the good news is, Loretta, that your brother is waking up and that he wants ice cream. That's a good thing. That means his brain must be working. So that's the positives. If he's neurologically intact, which it sounds to me like he is, if he's nodding, if he's, can answer questions appropriately, then the question of a tracheostomy, whether he should have a tracheostomy or not, lies in his ventilator settings, right? So he's in a medically induced coma. They are lowering medications. Does that mean he's strong enough to breathe up and have the breathing tube removed and breathe on his own? That's where the question really lies with, and the answer. What are his ventilator settings? Is he breathing in CPAP, pressure support, ventilation mode? Is his breathing rate normal between sort of 8 to 20, 24? Are his tidal volumes adequate for his weight, which means 7 to 10 mils per kilo? So let's just say your brother is 80 kilos, 7 to 10 mils per breath. That means around 650 to 800 mils per breath, right? So if that is maintained, what is his PEEP like? Is PEEP less than 5 or 5? Is pressure support less than 10? Are his arterial blood gases within normal range? Is he having a good strong cough? Can he clear his airway? That is when he can actually be taken off the ventilator and won't need a tracheostomy, right? If he's not ready to be extubated because the support he needs from the ventilator is too high, then he will need a tracheostomy. On the other hand, it also depends how many days he's been in the induced coma for. Maybe it's only been a couple of days. Maybe it's only been 3 or 4 days. Then he certainly shouldn't have a tracheostomy. It should only be done day 10, day 14. So you need to look at timelines as well, right? If he's awake, if he can obey commands, if he can have a meaningful response to questions, if he's breathing in pressure support, CPAP, on low settings, he can clear his airway, his arterial blood gases are fine, then he should be extubated. So I hope that helps. And then a tracheostomy is not needed. If you can't meet that criteria, then a tracheostomy is needed after day 10 to day 14 of mechanical ventilation and the breathing tube. And I have written an article about how to wean a critically ill patient of the breathing tube and the ventilator, and I will link towards that article below. You can have a look at it in more detail. I have worked in critical care nursing for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and where I've been consulting and advocating for families in intensive care since 2013 here at intensivecare.hotline.com. And we have helped hundreds of clients at intensivecare.hotline.com and members. We have a membership for families of critically ill patients in intensive care. And we have saved many lives, and you can confirm that on our testimonial section at intensivecare.hotline.com. Click on the testimonial section, or look on our intensivecare.hotline.com podcast, where we have interviewed some of our clients, verifying that we have saved some of their loved ones' lives. And that's why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecare.hotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And that will help you to make informed decisions, have peace of mind, control, power, influence, so that you can influence decision-making fast, so that your loved one gets best care and treatment. I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I talk to doctors and nurses directly. And I will handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also represent you in family meetings with intensive care teams when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, or if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share this video with your friends and families, comment below what you want to see next, what questions and insights you have. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.